We recently shared the story of this Arizona nurse who went to New York to help when their COVID cases were peaking. Then he got diagnosed with an aggressive brain tumor. He did not have health insurance, so hundreds of strangers stepped up to raise hundreds of thousands of dollars to cover his medical bills. It's hard to imagine a healthcare worker putting themselves and their families at risk in the pandemic, being uninsured. Nick, I think most of us just assume their employers have them covered.
I did, but I was able to catch up with a local nurse who says, sadly, this is a lot more common than you might think. She is right now deployed as a volunteer for Arizona's COVID surge, where she wasn't offered any additional benefits, and says the options for out-of-pocket private deductibles are simply too unreasonable.
We leave our families and go to wherever they need help.
Joanna Fakori's been a nurse for 8.5 years. Last month, she responded to the state's call for more doctors and nurses to help with our COVID surge through the Arizona Emergency System for Advanced Registration of Volunteer Health Professionals.
Basically, you pack up, you leave home, and you go somewhere for 13 weeks. Most of us are volunteers. Some are getting paid, some are not.
Right now, she's 5 weeks into her deployment in Prescott, where she's exposed to COVID patients every shift.
I'm definitely afraid of bringing it home to my parents.
Her parents live with her. Both have pre-existing medical conditions.
To me, it's like, well, if we're coming to help you, regardless if you're paying us or volunteering, I do think we should have some kind of coverage, whether it's from the hospital or from the state.
As a traveling nurse, most contracts don't come with health insurance benefits, and if they do, Joanna loses coverage with each new assignment.
I think the number one question is, hey, where do you guys get your insurance from? Because we don't have any.
Right now, a lot of her pay is going towards renting a place up north while she maintains her mortgage here in the valley.
I have no problem paying a decent premium. It's the deductibles we're coming across that are like $5,000 and $6,000.
She shared this post in a Facebook group for nurses and got an overwhelming response from other uninsured healthcare workers in the same boat. A single mom of 2, uninsured family of 4, nope, none here, I don't, can't afford it, too expensive. At last check, she said, of the 268 nurses who replied, 160 were uninsured.
Nurses will always just jump into anything to help anyone, despite our cons for us, what's working against us.
Okay, so to be clear, while nurses like Joanna are paying out of pocket as they go, crossing their fingers they don't get sick, hospitals will not turn anyone away if they're uninsured, and anyone can purchase their own insurance coverage. I did reach out to the state to see how many nurses who responded to the COVID surge might be uninsured, and they say they couldn't give a specific number, only saying more than 5,000 signed up and more than 500 are currently deployed, and those benefits are really contingent on where they're contracted.